But somebody who's maybe feeling lonely and stressed, a doctor can't do too much about that. I'm still on antidepressants, but I've gone from the absolute maximum dose to the absolute minimum dose. De facto has kind of been like, nope, just don't deal with that. And this super stressful thing, I'm just going to distract myself from it by doing these other super stressful things.
Welcome, everyone. My name is Kimberly Bliss with MedShadow's Culture Desk, a side effect perspective where we do book reviews, podcast reviews, TV show reviews with a side effect perspective. And today we're very excited to have our special guest, the author Julia Hotz, who is here today to talk about her book that we recently reviewed in Culture Desk, which is The Connection Cure. So I loved this book. Julia, thank you so much for being here. And I guess what I really wanted to start off with, which was my first question when I started the book, was what is social prescribing?
Sure. Well, thank you so much, Kimberly and the MedShadow team. I love the work you do. It's so important we get the whole story on medication. And I think the Connection Cure is about that. And social prescribing, which you've just asked about, is one way of thinking differently about health and medicine. So the technical definition is a non-medical resource or activity that health workers literally prescribe to improve their patients' health and strengthen their community connections. So examples that could mean fresh produce prescriptions. It could mean a prescription for help with housing, some of the more practical things. Most of the time, though, it means a social prescription for some sort of community activity, such as a cycling group or an art class or a community belonging dinner. So social prescribing really, and your listeners will know this term, I'm sure, is about addressing social determinants of health.
And you spoke in The Connection Cure about how important those social determinants were. And I should also say another thing that readers will appreciate is that it's very scientific research based, and so I wondered if you could go into that a little bit.
It's scientific research based. And also, I'm sure your listeners and readers will know that we feel the social determinants of health. And so what that means is up to 80% of our health is determined by factors like where we live, how we live, with whom we live. So it could mean very practical questions like, do we have a stable job, a safe home, access to fresh food and water and clean air? But then there are these psychological social determinants of health. Like, do we feel a sense of belonging? Do we feel we have a reason to wake up in the morning? Do we have ways to cope with the stress of the human experience? So I think we hear social prescribing and we think like, what is that forced friendship? Is it forcing socialization? That was my first impression, but it's really this broader thing about addressing our social determinants of health, which we know from indigenous wisdom, Eastern medicine, holistic medical experts, lifestyle medical experts, that your health is very much influenced by your environment. And just as some environments make you feel more sick, some of them can make you feel more well. And that's what social prescribing aims to do.
I also loved, you did extensive travel and the stories were very compelling. And we get to, in The Connection Cure, meet a lot of the people that you met. It's also interesting. I feel like it's newer here. Definitely seems like it has more attraction in England and Canada, for example. Here, we go to the doctor, you say, what's wrong? You're diagnosed, you're given a treatment, rinse and repeat. Right. So at what point would a social prescription be integrated into that part of experience with our healthcare system?
Yeah, you're totally right. Most of us, wherever we live, healthcare is very much one of what I call diagnose, treat, repeat. you know, and for most of us, I'm curious for you, our earliest experiences with healthcare confirm this idea. Like most of us, the first time we go to the doctor when we're kids, we probably have something like strep throat. The doctor runs a test, tests for the positive, strep bacteria, and gives us an antibiotic. And there's a reason, though, we don't have a strep throat epidemic, right? Because that is a really effective way of treating strep throat, something that has a clear biomedical cause in the body. But there's reason to believe that a lot of the illnesses with which people are struggling with today, the burden of our healthcare, are related to our lifestyle. They're very closely correlated with mental illnesses. And I want to be really clear and say, I think in some cases, for some of these illnesses, medication can help you cope with the symptoms. Therapy can help you figure out coping mechanisms. But if it were as simple as diagnose, treat, repeat, then we would not have these overlapping epidemics of depression, anxiety, loneliness, stress, ADHD, lifestyle diseases. And so, to your question, how does somebody come to get a social prescription? Right now, where I am, where we are in the United States, this feels like totally aspirational. I think it is important to also say that some doctors have been doing this for a long time and they are just not calling it social prescribing. But for them, what it maybe looks more like is recommending that their patient gets more exercise or spend some time in nature. The actual prospect of writing a literal prescription the same way they'd prescribe any other pill. This is my symbol of the book, by the way. It's a little pill bottle, but with people and nature in it. Anyway, it's going to take some work to get to the US. But here's why I think that it can come here. And maybe let's start by talking about the origins of social prescribing, which you're right, is very much popular in the UK. Social prescribing, the origin story of this is in the 1980s when the UK was dealing with all kinds of economic inequalities, epidemics of stress, people coming to the doctor for non-medical reasons. And maybe your listeners and readers know that in the UK, they have a public healthcare, national healthcare system. So everybody pays a tax and buys into this, and everybody has access to care. But when you have patients coming to that national healthcare system with issues that are really non-medical in nature and are at least partially socially determined, that puts a huge stress on their healthcare system. One of the stats that preceded social prescribing is that 1 in 5 people in the UK come to the doctors for non-medical reasons. Yeah, some stats time. 50% of GP appointments there are made for long-term conditions like type 2 diabetes. 70% of spending goes towards managing these long-term conditions. So you think in a healthcare system where everybody's paying in, that's a problem, right? There's a big incentive to reduce pressure on that system, because what was also happening is that people who really did need not medical care, like I tell the story of my friend Gabby, who her throat turned black, but she didn't want to go to her GP because she knew how hard it would be to get an appointment and thought, oh, I don't want to bother him. This will just go away on its own. Like, that is somebody who needs to go to the doctor. But somebody who's maybe feeling lonely and stressed, a doctor can't do too much about that. Just real quick, the story of social prescribing there is that the UK invested in social prescribing mainly as a solution to this pressure problem. And also because in 2018, the UK became the first nation to appoint a minister of loneliness, meaning a paid government official to manage their loneliness epidemic because of how profoundly it was impacting them and frankly impacting their healthcare. So there was a big incentive in the UK to do this, but in the US, I think it'll look a bit different. I mean, I think you and your MedShadow listeners and readers know that, of course, in the United States, there is a huge presence of pharmaceutical companies. Part of the reason we sort of have this culture of diagnose, treat, repeat, the US is one of 2 countries in the world where it's legal to directly advertised to consumers is because of that influence. So that's a tough force to contend with, because you don't have the same money behind going out and being in nature or speaking for the trees. There's just not an equal weight. Big pharma is a big force here. Another question that I get, or rather assumption that this will never work in the US, is because we have private insurance. Why is insurance going to cover a prescription for an art class or a cycling group? So this I'm hopeful about. And if you think about it, what is an insurance company's incentive? It's to spend less money on their patients, right? There's a reason when you and I go to the doctor, we say, hey, are these tests, is this appointment covered by my insurance? They say, I don't know. It's because insurance companies have a very complicated algorithm as to what they cover, how much, very focused on symptoms and sort of the conventional treatments. However, if they knew that investing in something would lead them to spend less money on their patients. So let's say, and this is common in America where we have patients on 3-4 medications, if there was a way for that insurance company to bring it down to one medication and spend less money on that patient, well, they'd be interested. And all of your lifestyle medicine listeners are probably thinking, well, duh, of course, exercise is super powerful and preventative for cardiovascular disease, high blood pressure, type 2 diabetes, which is why I think more insurance companies are covering gym memberships. My parents, for example, they just switched insurers, and my mom gets her gym covered now by her insurer. And that's becoming more and more a norm, because it's found that investing in physical activity, that makes it more likely that someone will be able to manage their own health and not be an expensive burden to these insurance companies. What's really exciting, and this is can this work in the US, is that more and more that same logic is being applied to social prescriptions, even for things like art. NJ Blue Cross Blue Shield is now doing a pilot with Newark's NJPAC, New Jersey Performing Arts Center, to actually cover the art prescriptions. So trips to the theater, glass blowing workshops, all sorts of amazing, wonderful cultural experiences there are in Newark. Horizon Blue Cross Blue Shield is covering this because they're seeing if this actually helps patients who are at risk of overspending on their insurance, if it will bring their costs down. And those results are still pending. But so far, what I can say is that the anecdotes have been really promising. And it feels good for providers too, to be able to prescribe an art class. We've been hearing more instances of that as well.
You do a great job in the Connection Cure breaking down 5 different prescriptions: the movement prescription, nature prescription, art prescription, service prescription, and belonging prescription. Did you meet someone where you're like, wow, this social prescription, like one of these 5 social prescriptions, is like absolutely perfect, quote unquote, treatment for whatever ails them?
Yeah, so I think there's 2 questions there. And the first one is about breaking down these 5 prescriptions, right? It's a really long title, but the reason I chose those 5 is because all of those activities are things that we humans used to do just to survive, right? Like if you wanted to make it in a hunter-gatherer society, you had to move your body. You had to spend time in nature and pay attention to it. You had to develop some kind of way to coexist with people, developing systems of mutual aid, developing rituals for belonging, creating art and sharing stories. And now, thank goodness, our lives are a lot easier. We don't need those things, but they actually do come with a lot of scientific benefits down to the chemical level. There's been a lot of good press about the health harms of loneliness. The U.S. Surgeon General Vivek Murthy compares the health consequence of this to smoking 15 cigarettes a day. We know that feeling lonely is associated with more stress, cortisol. And we also know that it's opposite, feeling a sense of belonging, having good, strong, meaningful relationships is linked with increased longevity. So much so that maybe you've heard of this famous study from Harvard. Researchers followed the same group of people for 80 years, trying to understand what led to a long, happy, healthy life. The number one factor, more than income, more than your marital status, more than any of the things that we prioritize in our culture, were strong social relationships. So prescribing someone belonging could be really good for someone who is at risk of feeling lonely. My book talks about kind of the archetype of loneliness. We picture an older adult, maybe, who's socially isolated. This guy named Glenn, he's in the United States. He was a veteran, and he gets a prescription for a virtual compassionate contact. But I also talk about Victoria, who is this 21-year-old who, lost all of her friends suddenly and is also experiencing loneliness. So she gets prescribed to join a cultural group. Service, for those who are in sort of the line of care related to pain management, this is really good for managing pain. And why is that? One of my favorite pain psychologists, Dr. Rachel Zoffness, talks about pain as being something that's biopsychosocial, right? We're not in pain 24 hours of the day, 7 days a week. There are certain moments within those days where our pain feels really intense and other moments where it feels milder. Social prescribing is about asking, when does your pain feel milder? What are you doing? My book tells the story about Akila, who is this amazing, caring woman. I go up to her. She gives me a big hug. She's a mother. She is a health worker herself. But she starts dealing with this chronic back pain. Back pain, is debilitating for anyone who experiences it. And when she goes to the doctor says to her, you need to rest. And Akila is like, I don't want to rest. I love my job. I love my family. I want to, keep being in this caretaking profession. The doctor says, no, Akila, you have to rest. So she does it reluctantly. And what does she find? Her pain gets worse. From there, I'm making a long story short, she becomes very angry. She becomes very upset. She becomes withdrawn from her loved ones. She eventually becomes depressed. And so she's prescribed both painkillers for her back and antidepressants. And she's given counseling. I want to say loud and clear that I know medication can be a solution for some people sometimes. But for Akila, whose pain was very circumstantial and was actually preventing her from doing the thing that she loved, she found that these didn't help her. What did help her, though, was when she finally got seen by a health worker named Joanne, who said, Akila, you're nothing's wrong with you. She had these feelings like something was really wrong with her. She said, nothing's wrong with you. I know what you really want. You want a job. You want to feel caring again. You don't want to be laying down thinking about your back pain. You want to be helping people because that's who you are. You're a carer. That's what you loved. So Joanne prescribes Akila a prescription to volunteer with this children's charity, to answer the phones, to talk to parents of kids with complex medical needs, as a way to still honor that this is what mattered to her without taxing her back. Sure enough, Akila finds this is the only thing that helps her. It's not as if she gets a service prescription, boom, her back pain is totally healed, but she finds that it helped her turn the pain dial down. It became less of a part of her life. And by the way, with antidepressants, this is not a call for anyone to suddenly go off them. That could be really dangerous. That was not the case for Akila. She found that her back pain was able to be managed on its own with a little bit of movement, stretching, physical therapy, and through this service prescription as well. I could talk about this woman, Amanda, who, like Akila, I meet her. She is bright, beaming, so caring, so much joy, so much energy. And it really shocked me when she revealed that 4 years earlier, she was diagnosed with major depressive disorder, had suicidal thoughts. And she knew that this diagnosis came after some very stressful, upsetting events in her life. They were that she found out her husband was cheating on her, so she got a divorce. She lost her mother, so she was dealing with the grief of that. She was fired from her job. Because of those three things, she had to move to a new place where she didn't know anybody. And also, this was during the pandemic. So she had 5 really stressful events that disconnected her from people that she loved, causes that she loved. So her depression diagnosis made total sense. So Amanda did have pretty severe symptoms. She was given the highest dosage of antidepressants. She was prescribed an SSRI, which works by blocking the reuptake of serotonin so that your brain is left with more serotonin. And serotonin is associated with better energy, better mood. Amanda takes this, but she describes her days as just being kind of dark. And even though she said the medication gave her a little chemical boost that she needed, it wasn't the whole solution for her. So Amanda one day learns about outdoor sea swimming group. And she lives, by the way, in, southwest England, where there's a beautiful seaside, and also it's cold. It's cold to go in that sea if it's not summertime. And this was a group that was meeting to go in the cold open sea all year long. Sounds wild to me, but Amanda, right. Amanda at first was really nervous about this, but she brought it up to her mental health nurse, and her mental health nurse just happened to mention that they were partnering with a local organization called Chill Therapy. That's who sort of runs these 10-week sea swimming lessons. And that it was targeted specifically for people dealing with depression and anxiety. So after that, she read about it in a magazine. Her sister told her about it. She said, okay, this feels like a sign. So her nurse prescribes her a spot in this group. And I go out there in the day in the water to swim with her. I get my own wetsuit.
You do?
Yeah. Which is, another thing. It was just so funny. I mean, most of the women in this group are in their 50s. And they're not wearing wetsuits, they're badasses and they're ready to take on the cold open sea themselves. But Amanda goes in and she's describing in real time how this had been like an antidepressant for her. She talks about when you first go in the water, the sort of shock to your system. This is why some people love cold showers. She talks about how challenging it was at first and how much she felt like she had grown. She talks about how joyful it is, right? Like when everyone's entering the water for the first time and it's cold, how people are like laughing and sort of jumping and making these noises with their bodies. And most importantly, she talked about how she met some of her best friends through this group, her community of fellow swimmers who now, even though her social prescription is done, she still meets up with. And Amanda said to me, I'm still on antidepressants, but I've gone from the absolute maximum dose to the absolute minimum dose. My real medicine is coming out here every Saturday to do this swim with these ladies. She said, that's been my lifeline. It's what gets me out of bed in the morning. And so I think that's an example of how Amanda and Akila, one of them, antidepressants were not the solution. Another, it was at least part of the solution, but both of them benefited from having their social prescription as part of their plan, because sometimes with these pill prescriptions, they end up becoming lifelong and they're not really supposed to be. But one beauty of social prescriptions is that they are supposed to be lifelong. After you take that 10-week swim course, after you do that volunteering, you're supposed to make this more of a part of your life. And sure enough, both of them have.
In what ways can social prescribing sort of manage, replace, or avoid the side effects of medication?
That's a great question. We do know the literature on antidepressants, for example. It can be really, really hard to withdraw from them, especially if you've been on them for a long time. And part of that is because the withdrawal is so intense and can lead to all these side effects. Not to mention that antidepressants themselves are associated with side effects like a sort of emotional numbness is a big one, sexual dysfunction, weight gain. Most antidepressants work as SSRIs, selective serotonin reuptake inhibitors. And what that does is it releases serotonin in your brain because it blocks the reuptake of serotonin. And effectively, they leave your brain with an excess of serotonin. But the science also shows us that when you prescribe yourself movement, when you're running and engaging in some kind of physical activity, and or when you're in the sunshine, this can also release serotonin. And it can do so without all of the side effects that SSRIs come with. So I think for somebody like Amanda, who was able to reduce the prescription on her SSRI, I think part of that had to do with because she was complementing her pharmaceutical prescription with a social prescription for an activity that got her moving and in the sunshine.
You actually have a revelation of your own towards the end of the book. And I was wondering if you could talk about what actually drew you initially to writing The Connection Cure, and if towards the end of the book, like the revelation that you had later, if that changed
Definitely
how you wrote the book.
Yeah, definitely. It's a great question because I think there's like the surface level answer of why did I write this book? That one is that I'm a journalist and I've reported on mental health. I was noticing the mental health trends after COVID, during and after COVID, especially a lot of headlines about loneliness. But then it was also anxiety, depression, ADHD. And then it was also lifestyle illnesses. And I thought, geez, all of these things are probably related. And I'm a solutions journalist. So when I see that there's a widely felt problem, I want to know, what are people doing to solve it? And so when I first started writing the book, I went in with this like journalistic hard hat, like, okay, social prescriptions. Let's see what that's all about, right? It was a solution that 30 countries all around the world are independently arriving at this because it is such an intuitive idea that our environments influence our health. That was the original reason. But then by the end of the book, I think I had really seen myself in some of these characters and these stories. I realized that maybe I wrote this book actually because I want better tools for coping with my occasional mental health struggles. You know, my de facto has kind of been like, nope, just don't deal with that. And
Can relate.
Can relate, right? Like this super stressful thing, I'm just going to distract myself from it by doing these other super stressful things. The line between illness and unwellness is very blurry. In other words, we have this DSM that is kind of become like the Bible of psychiatry. And, you know, we have symptoms of depression disorder, anxiety disorder, ADHD. And it's pretty rigorous in terms of you have to have 5 of these symptoms for 2 weeks. You know, each of them has very specific criteria. But then I would look at those symptoms and I think I experience that sometimes, right? And yeah, of course, maybe we all experience these from time to time just by virtue of living in a world that wasn't really designed for us. So I became really curious to apply social prescriptions for my own little spells of unwellness, I call it. And I'm really clear to say, like, one example is I go through this breakup, and me going through a breakup and feeling sort of sad and withdrawn and low energy and ruminating is not the same as somebody who's in the thick of clinical depression. What I think is beautiful about social prescriptions, though, is you don't have to be really sick and in the throes of a mental illness to try them on. They can still have those benefits. And so with that breakup example, you know, I really did. I thought about Amanda and I noticed how much joy and energy she got from moving her body. And so I prescribed myself a group called Back on My Feet that meets 3 times a week to go on these like early morning system shocking runs, very early, 5 a.m. And it's not the same as a sea swimming prescription, but it's giving that shock value. It's moving your body, which I should have mentioned this earlier, but part of the reason why movement is so effective for symptoms of depression is because movement is linked with the release of serotonin, just like antidepressants. Movement is linked with the release of endorphins. Maybe we've heard it described as runner's high. And so I thought if I prescribe myself this, maybe I'll start experiencing some of those benefits. And sure enough, I do. But I think the sort of grand finale conclusion that I make is these 5 ingredients movement, nature, art, service, belonging. It's true that scientifically there's some real benefits to prescribing yourself those things. But what I think you do when you prescribe yourself a form of that in community, what you're really doing is you're taking yourself out of your own head and it's forcing you to be present. And it is, a way of sort of distancing yourself that in the moment, the suffering and the symptoms, they feel so real, they feel so permanent. But when we take that leap and prescribe ourselves these things, we get out of our own head and we're able to see those symptoms for what they are, which are passing and part of the human experience. And so I think, and maybe this is the third part of the question we were talking about earlier, like what would it really take to bring this to the US? I think insurance companies have to adopt this. I think doctors who are overpressured totally need better tools to integrate this. But I also think patients like you and me need to see this is actually something that could help. And yes, it would be easier to just take a pill or go to therapy or try some self-helpy thing that like temporarily alleviates the symptoms. But I think that what social prescriptions uniquely do is that they give us a more sustainable source of recognizing why those symptoms are there in the first place and what the opposite of symptoms feel like.
Julia, thank you so much for this conversation. I loved having you on, and everyone definitely should check out The Connection Cure. There's a lot of good science and personal stories, and it's a great read and resources. So thank you so much, Julia.
Oh, thank you so much, Kimberly.